Hi, good afternoon. Thanks for joining us. My name is David Farnes. I'm the Mobile Health Lead with the Canadian Advanced Technology Alliance, and you're watching CATAnet TV, the Mobile Health channel. Joining us this afternoon is Ryan Wilson, who is CEO of a great company out of Vancouver, Medeo. And Ryan's going to join us today to talk about the solutions they're bringing to market in the healthcare space, and what his plans are really to bring his services across Canada. So welcome, Ryan.
Thanks for having me today, David.
So why don't you set the stage for us and talk a little bit about Medeo and what it is exactly that you're trying to bring to market.
So Medeo is a service that allows patients and doctors to securely connect online for electronic visits. So about half of all physician-patient visits don't actually result in the physician laying hands on the patient. And so Medeo provides secure video conferencing, secure messaging capabilities so that people can see their doctor from the comfort of their own home, their office, anywhere they have internet connectivity.
Excellent. And now, are your services primarily offered in BC, or are they offered elsewhere?
So we offer the Medeo platform to healthcare practitioners, so physicians, pharmacists, dietitians, any licensed healthcare practitioner on a global basis, although most of our business is in Canada and primarily in British Columbia and Ontario.
And what makes those markets, say BC and Ontario, more attractive than other provinces?
Well, British Columbia is where we founded the business, and the government in British Columbia, the Ministry of Health, has some very forward-thinking policy in terms of the physician compensation schedule, where they've created specific fee codes to pay doctors for seeing their patients online. Formerly, all of the provinces across Canada generally have these what are called telemedicine fee codes, but they tend to require the physician and the patient to be at a hospital or at a health authority site, essentially in a government facility in those, sort of traditional, $10,000 to $100,000 room video conferencing systems. And BC changed the legislation to allow the patient and doctor to be anywhere. So that essentially set the stage for us to build this new technology and offer it to the people of BC. So the first patient was seen here in BC in January of 2013, and since then tens of thousands of patients have seen their doctor from all over the province.
And so I'm interested because I kind of thought I knew about the change in the billing practice in BC, and obviously billing codes is an important enabler for a technology, a solution like this, and for many other mobile health solutions. I'm curious about what is happening in Ontario and elsewhere across the country in this space.
So in terms of Ontario, Ontario has the advantage of a great deal of their physicians being paid on a capitated basis. That is, rather than getting paid each time you go and see the physician, they're paid sort of per patient per year to keep you healthy. So this outcomes-based compensation or alternative funding plan means that the doctor doesn't necessarily need a telemedicine fee code in order to generate value for themselves, for the province, and for the patient by offering virtual care. So the uptake in Ontario has largely been in family health teams who are eager to improve access to care for their patients, help keep their patients out of hospital, and help them to avoid boomeranging back into the hospital after they've been sent home.
Just a question here from John Reed, CATA's CEO. Did you encounter resistance points? I mean, anytime you change your way of doing things, you always meet some roadblocks. It looks like you're past that now, but what were the obstacles? What did you face in introducing this innovation?
Well, there's been a great deal of parties we had to bring together. Oh. Sorry, we got caught by my screensaver there. There was a great number of parties we had to bring together to make this a reality. I struggle to find another industry with so many different players. The joke often in healthcare is there's 50 people who can say no and no one person who can say yes. Yeah. But we were very fortunate. We connected with all of the various regulators, to understand any requirements that they had, especially in and around security and privacy. We contacted the Ministry of Health. We built a physician advisory board. So as we built the technology, we looped in a number of the senior experts in the community to understand the issues, because this had never been done in Canada before. And there's certainly some new challenges and new questions that are brought up with any new care delivery means. So generally speaking, as with any new technology, much like when we brought out automated teller machines, many people for a long time still prefer to go to the teller and go to the bank. So we focused on the early adopters, which I'm pleased to say didn't have a bias necessarily towards young physicians or old physicians or rural or remote or urban. It's really been taken up from a wide range of practitioners and patients all over the province.
Yeah, great answer.
Now I read. Oops, sorry. Go ahead, Ryan.
David. One last thing is I think that the key to success, or one of the keys to success in the healthcare technology space, is being able to bridge those gaps between the medical schools, the professional associations, the doctors of BC, and the college, because it's a number of different parties that are all responsible for a different aspect of our healthcare system, and being able to get everyone together and collaborating on a new technology, I think, is critical to success.
Great point, Ryan. Great advice for people, and I agree wholeheartedly with you. The value chain in a solution like yours, or almost any mobile health solution, is so great. There are so many partners that need to be involved and brought to the table. And of course, that's what we're trying to do with our mobile health advisory board here at CATA, is to bring people across the system, across the ecosystem together, to discuss the issues, to share best practices, and really try to identify enablers going forward.
Well, that's one of the things that I've really noticed about San Francisco and other other tech meccas, if you will, is there's a real willingness of organizations to help each other, and I think that sense of community in and around the startup ecosystem and in digital health in Canada is going to be a real win for us in helping young and new companies come to market. You inevitably make a lot of mistakes on the journey. I know we've had a lot of learning opportunities or learning moments, and it's great to be able to share those with other entrepreneurs.
Well, we really appreciate you taking the time today, Ryan, with us, and this is a great information piece for other entrepreneurs out there trying to bring solutions to the healthcare market, and hopefully we can do another follow-up with you in the future.
Certainly, I'd be more than happy to do a screen share demo of what it's like to see a doctor online if you can't yet do it in your province, and always eager to answer any questions you might have.
Well, you know what? I'll set up that demo. I'd love to do that. That would be fantastic. So thanks again for joining us today, Ryan. This is David Farnes with the CATAnet TV, the mobile health channel, signing off. Thank you for joining us.